In this video, we will talk about major depressive disorder, its diagnostic criteria, who is at risk, and the treatments of major depressive disorder. But first, let us know what is major depressive disorder. Major depressive disorder, commonly known as depression, is a mental illness that can negatively affect how you feel, the way you think, and how you act. And now, let us talk about the criteria of major depressive disorder. So in criteria A, there are 9 symptoms. And the first symptom is, of course, a depressed or sad mood, or not feeling happy or unable to feel happy or attain positive emotions. The second symptom is a lack of pleasure or interest. If a person lacks motivation to do things that they love to do, like cooking, going for a bike ride, or playing instruments. So guys, take note that at least one of these two should be present to consider that a person might be in an episode of major depressive disorder. Also, take note that depression is episodic, so there is an episode that can last at least 2 weeks. The third symptom is gaining or losing a significant amount of weight in a very short period of time without any change in lifestyle. For example, by dieting or exercising. Now let's talk about the fourth symptom, which is insomnia or the inability to sleep, and hypersomnia or sleeping too much. And the fifth symptom is psychomotor agitation or a change in body movements. For example, shaking, shaking of your arms, legs, or your whole body. And the sixth symptom is fatigue. Fatigue is a constant exhaustion or a lack of energy. Lack of energy to do things. The seventh symptom is worthless, worthlessness or guilt. Whether they've done something good or they've done nothing at all, they feel guilty or worthless. And now let's go to criteria B. Their ability to function in their schools or work is greatly impaired or changed because of the symptoms as well as their mood, thinking, and judgment. And in criteria C, talks about not being affected by the substance or by reactions or side effects of the medication that they are taking. Criteria D talks about not being affected by other mental disorders such as schizophrenia or other psychotic disorders. And the last criteria, or the criteria E, talks about not having or never having a manic or hypomanic episodes. Because if these two are present, it can qualify for a diagnosis of bipolar disorder. And now, let's talk about who is at risk of major depressive disorder. Who is at risk with major depressive disorder? People who have lived through abuse, terrible loss, or another traumatic occurrences, such as death of a loved ones or experiencing a terrible accident. And women have a higher risk than men of having major depressive disorder, and it can peak in their adolescence. There are more treatments for major depressive disorder, but these 5 treatments are the most common that they use for treating major depressive disorder. So the first treatment is psychotherapy. Second one is psychodynamic psychotherapy. Third is antidepressants. And the fourth is cognitive therapy. And the last one is SSRIs or selective serotonin reuptake inhibitor. So guys, thank you for listening and I hope that you've learned something about major depressive disorder.